You will not hear this story in hospitals. I found a method that literally freed me from nighttime trips to the bathroom within just one day. It is such a simple solution that it may bring a smile to your face, but it has changed the nighttime rest of many elderly people. My name is Lichonha. I am a general practitioner, and I have spent my entire career in Chinana, located in the Chelopukta province. Even now, at over 80 years old, I continue to open the doors of my clinic every day. I faced this problem myself. There was a time when I would wake up at night up to 5 times, dreading the dawn. Now, I sleep through the night without waking up, and you can experience the same changes as soon as this evening. When I graduated from medical school and began my first practice, I had a rather casual attitude toward such issues, often telling patients, well, it's just age. It happens to everyone. But upon reaching that age myself, I realized how profoundly such little things affect the quality of life. Waking up 1 or 2 times a night is not just an inconvenience. It undermines health and robs joy. I have gone through this myself. Imagine what it means in old age to spend the entire night peacefully without waking up. Many believe that nighttime trips to the bathroom are an inevitable part of aging, but my experience tells a different story. Over half a century of medical practice, I have learned one important rule. It is the small habits that can lead to significant changes. Every morning when patients see me in the office, they ask, "Doctor, how do you manage to maintain such clarity of mind at your age?" I always smile and reply, "Because I sleep well." Quality sleep is a remedy that surpasses any medication. How many times did you wake up last night to go to the bathroom? Have you thought about how much this diminishes your quality of life? Several years ago, after turning 70, I began waking up 2 to 3 times a night. The situation worsened, and due to a lack of deep sleep, I would wake up with headaches. During patient consultations, I lost focus, and sometimes I even dozed off right at my desk. I started wearing slippers with rubber soles to avoid stumbling at night. Only those who have experienced this can truly appreciate how valuable this method has become. Once, I almost wrote the wrong prescription due to inattention. Fortunately, the nurse caught the mistake in time, but at that moment, I seriously thought, this cannot continue. I could become a danger to my patients. I began searching for a solution. One patient, Grandfather Kimansu, particularly stood out to me. He was 72 years old and woke up 6 times a night, falling into depression. He said to me, "Doctor, I am going crazy. A sleepless life is torture." I still remember his weary face. At first, he requested sleeping pills, but after he started following my lifestyle advice, within just 2 weeks, the number of nighttime awakenings was cut in half, and after a month, the signs of depression disappeared. When he said, "Doctor, thanks to you, I am feeling the taste of life again," I felt a pride that is hard to put into words. There was another patient, Grandma Poksunhi. One night, while heading to the bathroom, she fell and suffered a hip fracture. Her recovery process was prolonged, and moving around became a real challenge. After giving up on trying to leave the house, she sank into depression. The trips to the bathroom turned out to be not just an inconvenience, but also a source of potential dangers. I experienced this myself. We solved the problem by installing nightlights leading to the bathroom, and my wife moved to another room because of my snoring. I tried various medications, but they did not yield results. I examined the bladder and checked for prostate issues, but found no serious problems. The only explanation provided was age. I began to confuse the names of former patients and repeated the same stories at family gatherings, which raised concerns among my children. Later, it turned out that the cause was simply lack of sleep. If the brain does not receive enough deep sleep, it does not have time to recover, and cognitive functions decline. You may also think that frequent awakenings at night are an inevitable companion of old age. But the story I am about to tell may change your perspective. One day, my wife noticed that I was drinking broth and eating a lot of fruits every evening. That was when everything started. I changed the timing of my fluid intake, and that very night I began to wake up less frequently. Gradually adjusting my habits, I unexpectedly found myself sleeping through the night without awakenings. Without the help of medications, doctors, or any special effort. At first I was skeptical. Could such a simple method be effective? But after studying medical articles, I found scientific justification for it. The balance of fluids in the body, hemodynamics, hormonal rhythms, all of this truly has an impact. I felt ashamed that, as a doctor with extensive experience, I could overlook such elementary things. My colleagues at the clinic were amazed. The doctor literally looked rejuvenated. My morning face no longer appeared tired. My attention and concentration during patient consultations significantly improved. But most importantly, I began to understand my patients better. Having gone through this myself, I could give more accurate and effective advice to those who suffered similarly. That is why I decided to record this video. Only by watching it to the end will you fully grasp the essence. If you subscribe and like it, it will help spread valuable information to a larger audience. As a doctor, I sincerely admit that I am ashamed of having prescribed medication for so many years without paying attention to lifestyle. Now I want to share this realization with you. Before resorting to pills and surgeries, there are 5 simple things you can try starting this evening. These are methods that I have tested on myself and recommended to many patients. They do not replace medical treatment, but rather complement it. Often, it is the simplest habits that turn out to be the most effective solution. Are you still worried about how many times you will have to get up at night to go to the bathroom? How would you feel if this does not happen tonight? Do you want to experience waking up in the morning refreshed and clear-headed once again? So here are 5 habits that can help you stop those evening trips to the bathroom. The first habit is to strictly limit your fluid intake after 6 o'clock in the evening. The majority of nighttime urine is formed from the liquids consumed during this time. Typically, water is expelled from the body within 3 to 4 hours after consumption. It is this evening intake of liquids that affects the number of nighttime awakenings. The kidneys function differently during the day and night. During the day, we are active and water is expelled more quickly, whereas at night, the body rests and retains fluid. Over time, this rhythm can be disrupted, and the body continues to produce urine at night almost as if it were daytime. Therefore, everything you drink in the evening directly impacts the frequency of nighttime bathroom visits. Take the example of Grandma Chvechenki, who is 74 years old. She used to wake up twice during the night. As soon as she stopped drinking water after 6 o'clock and gave up broths, she only woke up once on the first night. She noted, "If I had known it was that simple, I would have started earlier. Thank you." She had a habit of eating fruit and drinking tea after dinner. When she moved this to an earlier time, the results were immediate. Another example is Jikun, who is 67 years old. He enjoyed having a can of beer at 8 o'clock in the evening, but because of this, he would get up to use the bathroom 3 times during the night. I explained to him that alcohol increases the diuretic effect and advised him to drink beer at lunch or reduce his consumption. At first, he resisted, but then he admitted, "Now I prefer to sleep more than to drink beer." What can you do in practice? After 6 o'clock in the evening, do not drink water, avoid broths, do not eat fruit, and do not drink beer. Focus on solid foods rather than soups. Fruits should only be consumed during the day. If soup is served in the evening, eat only the thick part. If you feel thirsty, you can take a sip of water, but no more. If your mouth feels dry, Simply swish water around without swallowing it. It is especially important to strictly limit fluid intake for 2 hours before bedtime. Medications can be taken with a minimal amount of water. You should also consider the hidden water contained in food, fruits, soups, and cereals. However, do not overdo it. Excessive restriction of water can lead to dehydration and constipation. During the day, drink enough to maintain your hydration balance. If you have kidney or heart conditions, consult your doctor before implementing any water restrictions. Each of us has our own norm. Are you perhaps eating a couple of spoonfuls of broth in the evening out of habit? This seemingly small thing can significantly change your nights. The second habit is to combat leg swelling. This is a direct path to reducing the volume of nighttime urine. Throughout the day, fluid accumulates in the legs. When you lie down to sleep, it returns to the bloodstream and is converted into urine. This is one of the main reasons for nighttime awakenings. In medicine, this is referred to as gravitational edema. During the day, when we are standing or sitting, fluid accumulates in the lower part of the body due to the force of gravity. At night, when we lie down, the force of gravity ceases to act, and the fluid returns to the heart. Then it is filtered by the kidneys and excreted as urine. Leonby, 77 years old, lives by the sea in Namq and has been fishing his entire life. Due to prolonged standing, his legs often swelled, and he would wake up 3 times a night. However, when he started simply placing his legs against the wall while watching television, the number of times he woke up decreased to 1. He was surprised at how effectively this simple solution worked. Especially during the summer, when the heat intensified the swelling, his condition worsened. But after he began regularly elevating his legs, his sleep became sound at any time of the year. Jan Megjion, who is 71 years old, worked at the counter in a magical university and suffered from chronic leg swelling. Even after retiring, she would wake up 3 times a night out of habit. I advised her to elevate her legs above heart level every evening and to wear compression stockings during the day. After a week, she found herself getting up only once a night. In practice, this is simple. After dinner, elevate your legs above heart level for 2 hours. You can do this by placing your legs on a pillow while sitting on the couch or lying in bed. While watching television or reading a book, try to get used to keeping your legs elevated. The most effective position is to lie on the floor, press your back against the surface, and throw your legs up on the wall so that your body forms an L shape. Just 15 to 20 minutes in this position is enough to significantly reduce swelling. It is best to do this every evening after dinner. But there are nuances. If you have high blood pressure or heart problems, do not elevate your legs suddenly. Do it gradually, and if you find it hard to breathe or feel pressure in your chest, stop immediately. If you feel numbness in your feet, change your position and be sure to check for any skin damage, using soft pillows to avoid pressure on a single point. And if you have pronounced varicose veins, consult a doctor first. When you watch television in the evening, where are your legs? What if today you change this habit a little? The third habit is to always go to the bathroom before bed, even if you do not feel the urge. If there is any fluid in the bladder, it can be felt more acutely during sleep and may wake you up. During sleep, the body transitions into rest mode, but if the bladder is full, the brain receives a signal that pulls you out of sleep. Therefore, it is crucial to completely empty the bladder before going to bed. As we age, the volume of the bladder decreases, and its walls lose elasticity. While in youth one could comfortably hold 300 to 400 milliliters, in older age, the urge arises with just 100 to 200 milliliters. And since our sensitivity increases at night, even the slightest filling can wake us up. In the case of Menja, who is 81 years old, she developed the habit of always going to the bathroom before bed, even if she did not feel the need. After 3 months, she stopped getting up at night altogether. At first, it seemed inconvenient, she said, but now it has become second nature. Thanks to this, I finally started sleeping deeply. Menja had a habit of falling asleep right after the evening series. Now she always goes to the bathroom, even if she is very tired, and no longer skips this step. Donchal, who is 84 years old, suffered from hyperplasia and prostate issues, and even after visiting the bathroom, his bladder remained partially full. I showed him a simple technique that helps completely empty the bladder. Men need to gently press upwards in the area between the scrotum and the anus. This helps to expel any remaining urine. After that, Donchal began waking up at night significantly less often. The advice is simple. Always visit the bathroom before bed. Even if you do not feel the need, train yourself to empty your bladder before sleeping. Do not lie down immediately, even if you really want to. First, go to the bathroom. Do not rush. Focus on fully emptying your bladder. Take a pause, then try again. This helps to get rid of any residual urine. After finishing, also wait a few seconds to let the last drops out. Men are especially recommended to urinate while sitting, as this promotes more complete emptying. If you are taking diuretics due to kidney or heart issues, discuss with your doctor when it is best to take them. Usually, it is better to do this in the morning to avoid nighttime trips to the bathroom. Do you remember the last time you went to the bathroom before bed? Maybe tonight you will stop by again, just to be sure. The fourth rule is no phones in bed. The light from the screen makes the brain think it is daytime and increases urine production. The blue light from smartphones suppresses the production of melatonin, the sleep hormone, which worsens sleep quality and disrupts the production of the antidiuretic hormone, which is usually suppressed at night. This hormone helps reduce urine production and promotes deep sleep. However, when you are exposed to blue light, its production is disrupted, and the body's circadian rhythms are thrown off. Furthermore, if you watch exciting or distressing content before bed, the sympathetic nervous system is activated, making it harder to fall asleep. Shebyenson, who is 79 years old, used to fall asleep every night with his phone in hand, reading the news. After he stopped taking his phone to bed and began leaving it in another room, the frequency of his nighttime awakenings was cut in half. At first, it was unusual for him to fall asleep without his phone, he admitted, but now he sleeps much deeper and better. Later, he realized that he was particularly anxious about political news that he had gotten used to reading before bed, which caused him hidden tension. Now he watches the news after dinner and prefers to read light books before sleeping. This simple change completely transformed his nightly rest. Another example is Lee Kyeon-suk, who is 68 years old. For her, evening conversations with her children and grandchildren on Messenger became a beloved tradition. Every evening, she would chat with her family late into the night right in bed, but these messages constantly disturbed her sleep. I advised her to limit communication with loved ones until 8 o'clock in the evening and to leave her phone in the living room at night. At first, it was difficult for her to give up her habit, but after a week she admitted, "Yes, I miss the pictures of my grandchildren, but now I understand that sleep is more important than anything else. Leave your phone in another room before bedtime. Do not bring any electronic devices into the bedroom. Ideally, you should completely stop using them 1 hour before sleep. Make your bedroom dark, quiet, and comfortable for sleeping. Instead of looking at a screen, read paper books, practice meditation, or do some light stretching. If you do read from a screen, turn on the blue light filtering function, but it is better to choose a regular paper book. It is important to remember that not only phones but also televisions, tablets, and any screens should be avoided at least 1 hour before sleep. This is especially true for anxious or stimulating videos. They excite the brain and interfere with falling asleep. Instead, choose light reading or calming music. If you use your phone as an alarm clock, turn on airplane mode and place its screen down. Or better yet, use a traditional alarm clock. You fall asleep with your phone in your hands. But what if today you leave it outside the bedroom? The fifth habit: do not rush to the bathroom as soon as you wake up at night. Often, the reason for not fully emptying the bladder is actually a disruption in sleep. Our bodies quickly adapt to certain rituals. If you have woken up several times during the night and gone to the bathroom, your brain remembers this and starts waking you up at the same time. Even if your bladder is not full, this phenomenon is called conditioned awakening. Sleep occurs in several cycles, and brief awakenings at the end of each cycle are normal. But if you go to the bathroom every time, your body forms a habit. Wake up. Go. This habit needs to be broken. Munchun used to get up 4 times a night. At first, it was not easy to hold back, but she tried not to get up. After just 2 weeks, her nighttime awakenings decreased to 1. The first few days were a real challenge, she recalled. But now I sometimes even sleep until morning. She had a consistent schedule of awakenings at midnight, 2 o'clock, and 4 o'clock. When she learned to endure and not get up, her sleep became significantly deeper. Pak Chongi, 72 years old and after prostate surgery, suffered from frequent nighttime urination. Besides physical reasons, he was troubled by psychological anxiety. He feared that his bladder would not hold. I suggested a relaxation method and patience training. Upon waking, do not get up, but try to fall asleep again. At first, he was anxious, but gradually he gained confidence, and the number of awakenings decreased sharply. Advice: if you wake up, do not rush to get up. Lie still for 3 to 5 minutes. Focus on your breathing. Check if you really need to go to the bathroom, or if you just woke up out of habit. If possible, close your eyes and try to fall asleep again. Gentle breathing meditation can help. Take a deep breath and exhale slowly. Relax your body. Repeat this cycle 5 to 10 times, and you may find yourself falling asleep again. If you are experiencing pain or significant discomfort, do not endure it. In such cases, it is better to get up. If you have prostate hyperplasia, urinary retention, or other conditions, be sure to consult a doctor. This approach is not intended to suppress natural needs, but to break the habit of pointless awakenings. It is also beneficial to undergo examinations, as frequent awakenings may be associated with diabetes, heart failure, sleep apnea, or other diagnoses. Do you also head straight to the bathroom when you wake up at night? This time, try waiting a little and apply at least one of the methods I discussed today. One day can change a lot. Any illness is primarily a signal from the body, and those who recognize it earlier will begin to recover faster. This evening, choose just one thing. Limit your water intake, elevate your legs, visit the bathroom before bed, put away your phone, or practice patience during nighttime awakenings. Try it, and perhaps by tomorrow morning, you will wake up with a completely different feeling, refreshed, clear-headed, and full of energy. Do not strive to do everything perfectly right away. That will only create unnecessary stress. Start with just one thing. If you notice an effect, gradually add other habits. This is the key to sustainable change. Personally, I started by limiting fluid intake in the evening, and when I felt improvement, I introduced other methods. I have patients who, after making these changes, were able to stop using sleeping pills. Yes, medications can help you fall asleep for a while, but over time, they worsen sleep quality and can lead to dependence. Thus, they are not a long-term solution. Lifestyle changes are the safest and most effective path. In my 40 years of medical practice, I have found that the most effective methods are often the simplest. Small changes in habits can have a much stronger effect than medications and procedures. I have experienced this myself, and many of my patients have as well. When nighttime trips to the bathroom cease, the quality of life improves dramatically. You wake up refreshed, your day becomes more active, and your memory and concentration improve. The risk of falls decreases, your overall health strengthens, and most importantly, you free yourself from the stress and anxiety that used to accompany each night. To summarize briefly, here are 5 simple steps that can help you manage nighttime trips to the bathroom. First, limit fluid intake after 6 o'clock in the evening. Second, elevate your legs above heart level every evening. Third, always visit the bathroom before bed, even if you do not feel the urge. Fourth, completely eliminate phones and other screens from the bedroom. Fifth, when you wake up at night, do not rush to the bathroom. First, try to fall asleep again. If you adopt at least one of these tips, you may notice a difference on the very first night. If you gradually add the rest, the number of nightly awakenings will significantly decrease. It is important to understand that in our later years, even small habits from our daily lives can greatly impact its quality. I sincerely hope that your personal little changes will begin tonight. Although I am 80 years old, I continue to open the doors of my clinic every morning and see patients. When people ask me what my secret to vitality is, I confidently respond that it is quality and deep sleep. Full sleep is the foundation of health and the key to happy and peaceful aging. In the next episode, I plan to discuss age-related urinary incontinence and bladder issues in older adults. I sincerely wish you good health and harmonious aging.